you have like two diametrically opposed forces in industry right now. You have the wild west of big LLMs, whether you're OpenAI or Gemini or Claude or I don't know who uses Grok, but maybe people do. And you'll be like, hey, I need to increase my strength and lose weight. And it'll be like, here are some popular exercises. And what it should have said was, how old are you? Because if you're 94 with osteoporosis, it shouldn't have recommended burpees.
Try to fix the current system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show, this is a mission, y'all. As healthcare leaders, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, we have the Flava of the week about Microsoft launching Copilot Health last week. How are big tech's investments in healthcare AI platforms changing the game for patients and providers, as well as showing us the need for guardrails and a shared understanding of how they work? I'll talk about that. Then Aaron Patzer, founder of Vital and former founder of Mint.com, dives deep into the need for a standard in patient-facing health AI, the effects of not having one, and his advice for consumers when using ChatGPT and Claude to answer health questions. I'm Jared Johnson. Let's get it. Flava of the week. Microsoft's new healthcare platform launch is attempting to bring medical intelligence to the masses. On March 12th, Microsoft announced Copilot Health, which they describe as a separate, secure space within Copilot where medical intelligence makes sense of your information and delivers personalized health insights that you can act on. Copilot Health brings together your health records, wearable data, and health history into one place, then applies intelligence to turn them into a coherent story. Copilot Health doesn't replace your doctor. It makes every minute you have with them count more. You arrive prepared with the right questions, the right context, and the confidence that comes from better understanding your own body, where the connection between your broken sleep and the reasons why become visible, where you stop scrolling symptoms at midnight and start having better informed conversations. They also talk about what they refer to as medical superintelligence, health AI that can ultimately combine the wide-ranging knowledge of a general physician with the depth of a specialist. Their goal, they state, is to get people to the right place in the healthcare system or the exact right doctor. They want people to feel like they have the knowledge that allows them to make their health decisions. Microsoft is making Copilot Health available through a careful phased rollout, opening a waitlist to join their early community, shaping the experience. What's the consumer lens? Digging into what they provide on their website, I found three things interesting. First, they state that their consumer products already respond to over 50 million consumer health questions a day. That's a lot. And add it to the hundreds of millions of weekly health-related questions already being asked to ChatGPT and Claude, and you can't deny the demand here. Second, they address the question of health sources that you can trust by stating that they've improved the quality and reliability of answers by elevating information from credible health organizations across 50 countries. Third, the inevitable claim of all your health data in one place, which in their case they state includes activity levels, sleep patterns, vital signs, and other trends from over 50 wearable devices, including Apple Health, Aura, and Fitbit, comprehensive lab test results from Function, and health records from over 50,000 U.S. hospitals and provider organizations through HealthX, including your visit summaries, medication list, and test results. In summary, get ready, folks. We're going to remember 2026 as the year that generative AI changed consumer health, and these moves in the first few weeks of the year from OpenAI, Anthropic, Amazon, Microsoft, and others are just the beginning of what's to come. Let's acknowledge the big tech's investments in healthcare AI platforms are changing the game for consumers, as well as showing us the need for guardrails and a shared understanding of how they work. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the week. The flow. All right, everyone, let's get into the flow. Every now and then see something on LinkedIn that just kind of stops me in my tracks. And I say, I want to learn more about that. And that was the case this week when I saw a post from Aaron Patzer talking about a new way to evaluate and actually create a standard around health AI. So I said, can we get you on the show? And thankfully, Aaron said yes. So Aaron, welcome to the show and excited to get going here today.
Thanks for having me, Jared.
I think it's worth mentioning to people some of your background. Yes, that Aaron Patzer, yes. Former founder of Mint, founder of Vital, and just an influence in the healthcare space. I feel like that's safe to say, an influence. You're a voice that I pay attention to. So I'm grateful to have a few minutes with you today.
Yeah, thanks. Just by way of background, it's always funny to prop yourself up, but I'm the co-founder and CEO of Vital.io. We guide about 7 million patients through emergency experiences, inpatient, urgent care, surgeries, and then what to do after their visit. So it increases patient scores, retention for health systems, and improves patient outcomes. There's people who are much less likely to bounce back to the hospital or the emergency room, better patient education, more people taking their medications. It's exactly what patient experience should be. And then, as you said, I was the founder of Mint.com. That got to 25 million users. And then I was the head of product for Intuit. So if you've used TurboTax or QuickBooks or Quicken Mint, I've had my hands on all of those. So I feel really lucky. I just love to build stuff. I'm an engineer by training.
Yes, I can doubt. Well, not just build stuff, but build things that solve big problems. I mean, a lot of people are aspirational about that.
One of the things that is sort of a guiding principle in my light is the technology is a means to an end, and it's a means to really helping people. So with Mint, one of my proud accomplishments is we save people $9 billion in bank fees and missed interest. And in some sense, consumers get screwed over by big banks who are paying them too low, that are charging them too much. I feel really proud about that. And we're taking that same ethos to Vital, where a lot of the times the healthcare system does not work for you. There are very few people besides you and your family who really care about your health. And so Vital is really designed to be kind of what I have. My brother-in-law, who I started this venture with, he's been my doctor in my pocket for 15 years. I'll just be like, hey, I got this white thing on my lip. What's going to happen? Hey, my wife did this thing to her leg and now it's twitching. What's going to happen? And it's just amazing. And so if you can give that guidance of having a doctor or a nurse in the family to walk you through and explain everything and in real human terms, instead of you had a cerebral infarction of the left hemisphere or some doctor speak, to translate that into, I'm sorry, Jared, your mom had a stroke or whatever it might be, making things consumer friendly and digestible and in your own language, hugely important.
Like you said, it's central to a patient experience and it's central to how much people choose to engage in their health in between being a patient and show the types of improvements that can happen as we focus on it.
So the AI Care Standard was really built out of this. For anybody who wants to see it, it's just aicarestandard.com. And it's a nonprofit coalition across industry. We helped fund it, and I did a lot of the technology and tooling behind it. But what it is it's a standard for safe, patient-facing AI. And it's really needed because you have two diametrically opposed forces in industry right now. You have the wild west of big LLMs, whether you're OpenAI or Gemini or Claude or I don't know who uses Grok, but maybe people do. And you'll be like, hey, I need to increase my strength and lose weight. And it'll be like, here are some popular exercises. And what it should have said was, how old are you? Because if you're 94 with osteoporosis, it shouldn't have recommended burpees. And see this all the time. There are, if you want a depressing topic, go on Wikipedia and look up chatbot suicides or homicides. And there are literally dozens of chatbot psychosis or, hey, my son was spiraling into suicidal ideation. You didn't catch it. You didn't escalate it like a doctor or a therapist or somebody who has professional ethics would. And so we're actually doing quite a lot of harm to patients because you don't have the context of who they are. Google just got slapped for giving summaries, Gemini summaries that said, is this a normal enzyme value for a liver test? And it's yes, this is normal or this is abnormal. Well, Jared, it depends. It depends on if you're a man or if you're a woman and if you're old, or it depends on if you're 12 or 6 or all of these things. It needs context. And so this tool is about making sure that those tools have the right context, the right protections in place. At the same time, you have health systems that are so damn conservative, right? They're all run by lawyers. They're afraid of being sued. And so you get things like Providence Health, major health system in the Northwest, and they put out Grace AI. It's a chatbot, which commendable. Like, at least they did something, right? So I give them props for that, when most people are like, their AI committees are set up just to say no. And so Grace is a good concept, but you say, Grace, what's wrong with my last blood test? And it'll be like, I don't know what your last blood test is. Go look it up in the patient portal. And you're like, okay, so you don't know anything about me? And then you're like, hey, Grace, I've had a cough for 3 days. And it's like, go to the ER, 911, immediately. And I'm like, okay, you can't tell me 911 every time I stub my toe, because that is just going to push people to the unsafe stuff. If you're so conservative that you're effectively useless, then you're going to push people to the easy, dangerous alternative, because the big LLMs at least are easy. And, the reports are that like 300 million people have asked it health questions. And so we just wanted to try to make all of it safe and come up with a middle ground that any AI committee could use, any vendor could use, anybody developing technology, even internal projects. It's a checklist. And so I'll tell you more about the principles if you're interested.
Absolutely. And I'm interested too when you say we. I know this is kind of a consortium. Like there are a lot of members, including several major health systems involved.
The amazing thing about this consortium, should have led with this, is it's certainly not just us, right? It's Stanford, it's HCA, it's MedStar, IU Health, Children's of Los Angeles, Texas Children's, Hackensack Meridian, so those are on the health system side. It's payers or payvider, like Highmark Health in Pennsylvania. We have experts from there. Patients for Patient Safety, AONL, which is the American Organization of Nurse Leaders, people from the Veterans Administration. There's a huge group of people who have come together to say, this is what I've seen out in the wild. This is what we want to protect against. These are the principles that if you hit 80% of these and a few crucial ones, then this is safe for patients. And so it's absolutely needed. I've been to a bunch of these AI committees where I'm like, hey, this doctor-to-patient translator we have it's validated by 7 outside doctors, and it's 99.4% safe and accurate for radiology summaries. We added a judge prompt to see if there are errors, and now it's 99.8%. The last 0.2% is really like, honestly, human errors where doctors have contradicted themselves. And they're like, no. And I was like, well, what if I said it was 100%? And they're like, still can't say no because there's no regulation, there's no standard. And I was like, okay, great. In absence of a law, all these conservative health systems, well, this is the best industry consortium, industry standard you are going to get. It is the widest, adopted by biggest health systems. This is it. This is the beginnings of what we need to, I guess, tame the Wild West of AI related to patient care.
So tell me how it works or who initiates the process.
Yeah. So go to AICareStandard. There's 10 principles that you can follow, but I'm an engineer by training, so I'm like a very literal, possibly spectrum-y person. And so I like concrete things, and there's an evaluation tool, and it's going to say, question number 1, how is this model trained? And it gives examples of people who did it well and people who did it poorly. So it's like the original ChatGPT was trained on the open crawl. So that's like the internet at large. That's every Reddit post that has more than 3 upvotes. That's all of the pop health garbage that you find on wellness sites. It's not peer reviewed, right? And then you contrast this with somebody like an Open Evidence who's like, we're going to use the New England Journal of Medicine. We're going to train an LLM sort of specifically on that, or we're going to pull from that database and verify this up to date. Their LLM does the same sort of thing. Great example. If you are a health system developing your own AI, well, that's a problem, because if you're the Colorado has the lowest obesity rate. So they've got a different incidence of diabetes and all of these other things. That's not going to train well when you apply it to Georgia and Louisiana as an AI tool. So it's basic questions like, where's the data from? Do you have a good subset of ages? Does it work for the pediatric case or not? And then it's like, how do you validate it? Who validated it? Did you have doctors look at the output? Because you'd be surprised how many startups are like, this looks good to me. I measured the area under the curve and all these technical terms, and it looks good. And that is not good enough. You need actual trained, licensed physicians to do this. And then you need to make sure that you're retraining it and that you can test it out in the wild. For example, Epic put out this really crap sepsis model, and the University of Michigan found that they basically accidentally trained on billing code. So they knew the conclusion instead of training it at the time when you actually need to determine if there's septic shock in a person. And it was effectively useless. It had 109 alerts before you found one that was valuable. And then there's the patient protections. So this is where the chatbots really get it wrong. Can you detect that somebody is under psychological stress, that they have a new cancer diagnosis that maybe you actually, as a health system, want to delay or get a human in front of so you don't learn about cancer from or loss of pregnancy from an app? What do you do if there's suspected in the medical records elder or child abuse? Because you don't necessarily want to message the abuser themselves. There's all these protections that you need to put in there. Can you detect suicidal ideation, homicidal ideation? What do you do with it? Do you escalate it to an actual human care team who can do this? Or do you just say, call 911? Each of them gets sort of a different number of points. Do you disclose that you're dealing with AI? A lot of people don't disclose it. AI is behind the scenes. And so it's all these principles of disclosure and validation. And we did it in a way that is accessible to anyone, even if you are not an engineer or software developer. And it doesn't say, it's not necessarily just for LLMs, it's not for generative AI, it could be for machine learning, it could be it's technology agnostic, which is important.
Yeah. Okay. So what does success look like here? Is it just a widespread adoption of the standard at some point? Do you have some kind of tiers or goals here that you're aiming for?
Okay. So first would be if, an open AI and Anthropic and Grok and the major LLMs were like, this is a good standard, this is what people want. We can put some extra tokens to scanning your chat messages and detecting suicidal ideation. And we can make sure when people ask health specific questions, we say, Jared, how old are you? And what's your height and weight, or at least the just basics to give context. So that would be a great outcome. Now, we did talk to Microsoft and Amazon and OpenAI and to join the coalition. And a couple of them initially said yes. And then they said, we want to own all of the IP and all of the questions and everything that comes out of it. And we said, no, you cannot lock this down. So I won't name names on who specifically. So it would be great if they did this. And it would be great if health systems said, you know what, we really should be putting more AI in front of patients. It really is a valuable tool for people to understand their health records, which may be hundreds of pages if you've got a chronic illness, and to translate doctor speak into normal language and to do so safely. And this is the mechanism to do it safely. And all of you who are listening from healthcare who are so concerned about liability, well, this is now the industry standard. This is all of your peers and the big boys have signed off on this. So if it ever goes to trial by jury or a lawsuit, you can be like, this was the industry standard at the time. Okay, so just get on board, put more AI out there, do right by patients, and do it safely.
That's the center of thinking for so many healthcare organizations to begin with. So
right, I mean, they're going to be listening to this podcast, hopefully, and they're going to be like, yeah, that sounds great, but. And then my chief counsel. Okay, so I'm trying to give you the counter argument so you can go back to your chief counsel or send them this podcast. It's really been a rigorous process across vendors, technologists, academia, health systems, patient advocacy groups, nursing groups, medical groups. So it's the best we got right now.
What's your advice for consumers using any of these tools? The Wild West is the perfect description for it right now. You're right. There are stories on both sides. I've famously shared, even my 17-year-old son at the time was he was featured in Time magazine because we were able to have a time in the middle of the night where he was able to self-diagnose appendicitis, just talking into his phone. I'm like, the lesson it taught me was you literally can't stop people from using it. So what do we do with that?
So this is going to sound counterintuitive, but you should tell the L everything that's relevant about you. Maybe you don't give them your name and social security number, but you should be like, hi, Aaron, I'm 45. I weigh 170 pounds. My last blood test showed that I was high in this or that. I consider myself reasonably fit. I run every day, whatever it might be, and give it some clinical context so that it doesn't, when you say what are some ways to retain strength or to lose weight, it doesn't give burpees as the answer to a 94-year-old with osteoporosis, right? It needs the context of basically who you are, what diseases you have. And so you actually should tell it and you should save it as part of the system context, preserve, this is who I am. And I know privacy people are like, I can't do that, but it's way more dangerous not to have that context. If it has that context, it's still not guaranteed to be safe, but it's going to be a lot better than it is right now.
You're directing it to the right chapter in the book for the responses. Okay. Yeah, that makes sense.
Yeah.
Let's bring Vital back into the conversation here. Any recent announcements or accomplishments you'd like to celebrate there? What's the latest and greatest?
Yeah, well, unless this podcast is coming out in the next couple of days, next week we launch something that we call Vital Guard, because it is literally a guardian for your health. One of the things that's crazy is when we were doing this like doctor to patient translation, summarization of like your radiology test, there are all these things called incidental findings. And this is like you get into a motor vehicle crash, they're doing an x-ray to see if you broke your collarbone, and they catch part of your lung. And they're like, oh, by the way, Jared, you have a little mass, could be a cyst, could be something else on your lung. Or you have this pulmonary nodule or renal nodule on your kidney. They find this stuff all the time. It happens like literally like 10 to 12% of patients have this incidental finding. Guess what percentage of the time they actually tell the patient?
I'm guessing not that much.
30 to 40% of the time. So 60 to 70% of the time, particularly in the emergency department where it's rushed and they're trying to figure out, did you break your collarbone? Or what, do you have this bleed out or whatever it might be? They don't pay attention to what's on page 3. And this has serious consequences. So what we do is we find these with 97% accuracy, but most importantly, we find whether it's been disclosed to the patient or not. Maybe it's something old that you knew about. Maybe it was already, you've got a follow-up already. And this reduces liability for the health systems, generates revenue for more radiology, and more importantly, it saves people from cancer. We've literally saved lives in some of the pilot programs with this. And this was done in part in inspiration because my best friend lost her sister at age 29. She had Crohn's disease and was so happy to leave hospital because of a bowel bleed that nobody told her on page 4 that she had a lump in her breast that could be cancer. And it was. It spread everywhere. And it just should have never happened. And you'd be surprised how many people have stories like this. So Vital Guard is coming out. It's already out at a number of health systems. You should use it. It will reduce the amount of people that you have to have on this. A lot of the reasons that people don't follow up is like, it's overwhelming as health systems. You're like, there are thousands of these, tens of thousands of these. Hope they don't end up as lawsuits. We don't have the manpower for this. We have like a single radiology physician's assistant handling like an entire region, like 6 to 10 hospitals, hundreds of thousands of radiology images a year, because the AI is effectively their co-pilot or their assistant on this. It is inexpensive. It'll make you money in terms of the extra radiology, and it'll save lives, and it'll probably reduce your lawsuits. I say those things, and I feel like kind of sleazy about that, but hospitals care mostly about the revenue. I care mostly about the saving lives, but I gotta motivate the people who are listening to this. Doctors and nurses are great, but the business people are like, oh, what's it going to do for us on the bottom line, which it's just the way the industry is.
Aaron, last question for you before you go. What advice would you share, or do you share, with other founders in the consumer health space, the digital health space, anywhere in here?
My biggest piece of advice is Epic will eventually get in your way. They will try to copy your product poorly and then throw fear, uncertainty, and doubt into the marketplace by saying that they're going to do it in 2 or 3 years and it's on their roadmap. They've done that with us. They've done it with remote patient monitoring. Epic is stifling startup innovation the most. And so play in the spaces elsewhere is one of my biggest pieces of advice, unfortunately.
Really appreciate it, Aaron. Thanks for the time today. Thanks for letting us in on this. And we'll point people to the website. We'll link to AI Care Standard in the show notes and everywhere. So appreciate the time, appreciate everything you're doing to make healthcare consumer-centered.
Thanks.